And what we're starting to see is that like we can kind of satisfy some of these psychological needs in video games, although they're not like a complete satisfaction, but it's kind of enough. And so what's sort of happening is people are like starting to live their lives more and more like in the virtual world. And as they do that, they start to kind of get disconnected or fall behind in the real world.
What happens to your brain if you use video games excessively? You said what you're doing basically is you can create a feedback loop of satisfaction in the virtual world, which is incredibly difficult to replicate in the real world. I think that's what the point was.
And that's kind of, I think, the core point is once you start using it excessively, it becomes harder and harder to engage in the real world. And that's what we see when it rises to the level of true addiction.
What happens to your brain if you use video games excessively?
So in a nutshell, not good things, but I think a lot of people will wonder, what is excessive? So this is where we have to understand that the reason games are fun are because they fulfill particular psychological needs. They like scratch certain itches. And what the biggest problem that tends to happen, I know everyone talks about dopamine, and we'll get to that in a second, but the biggest problem that we see is that once you start fulfilling needs in the game, then your brain sort of has this really tricky kind of situation, because if you try to fulfill that need in the real world, it's going to be harder. And then there are all kinds of other like neuroscience-based effects that we kind of see. So we'll see, for example, alterations of like dopamine reinforcement. So people who play a lot of video games will start to become a little bit more anhedonic, which means that their ability to experience pleasure sort of goes down. So if you play a bunch of video games, reading a book just won't keep your attention. It becomes harder to like do sort of IRL stuff.
Is that some kind of dopamine set point or dopamine sensitivity that's been tuned down?
Yeah, so that's probably what's happening. What we tend to see is all the clinical features. So if you work with a gaming addict, you'll see like a lack of motivation. And motivation is primarily governed by like dopamine and the nucleus accumbens. We'll see anhedonia, which is the inability to enjoy particular things. And then other things that we tend to see is that a lot of addiction is not actually due to dopamine sort of making things fun.